Hi, my name is Linda Borgmeyer, and I'm the Director of Rehab and the co-owner of Novoleo Therapy and Fitness. We provide physical and occupational therapy in the home under a Medicare B to seniors. And today I had some exciting news. A couple weeks ago, we were audited by Medicare. And when Medicare, because we're a provider, they go in and they look at all the records, they look at the billing, they look at the notes. And we received some great news today that, and I quote, "Your notes are like a breath of fresh air." You know, there's a lot of misunderstanding about what Medicare recipients are allowed to have. And there's actually two really big ones that I want to talk about today. I want to talk about it from a clinical perspective, but I also want to talk about it from a recipient perspective, because it's important as a recipient that you understand what your policy allows you to have. So the first one is that there's a cap, that there's a yearly cap. And once you hit it, you don't get that money again. It's a one-time shot for the year. And that you would, if something else happened to you, that you wouldn't have any funds available for therapy. And that is not true. I'm going to say it again. It is not true. There is not a cap. It is called a threshold. And I'll tell you why. When you hit a certain threshold, what Medicare wants to know is, does this person need to continue with therapy? And if so, why? And so there's some extra paperwork that you do to say, yes, they do. Or if you can't justify it, then that's okay. But if you needed it, what is the cost of not getting it and having something traumatic happen, like a trip or a fall? Worst case scenario that I see, which really bothers me, is if a clinician says to you, you've hit the cap, you don't have any more money for therapy, but you need it so you can pay me privately. No, they can't. You can never, as a provider of Medicare services, you can never charge someone for something that would be covered by insurance. Never. So that it's just a few extra hoops. It's really simple. If you're a clinician and you're hearing this, we run classes all the time and we make them super cheap, because my goal is to get the information out there so that we're all doing the same thing, and that we're helping seniors to age in place or wherever they are, keep their pain down. The second thing is that if someone hits a point in their rehab where they cannot progress anymore, but they're functional, they should be discharged. Absolutely. They're fine. If someone has a disease process, and it doesn't have to be this, it could be just medical complexity is so high that if the therapist is not with them and watching over them, they're going to be at risk for falls or a higher level of care, having to go to a skilled nursing or assisted living, or from assisted living to a skilled nursing, which is a much higher level of care. There's a maintenance program. They made a maintenance program. You can look it up in CMS regulations. We'll have that listed down the bottom. But maintenance is specifically for those people that have comorbid diagnoses or a diagnosis, say MS, multiple sclerosis. It's a progressive neurological disorder. Parkinson's, progressive neurological disorder. It's prudent for a therapist to watch over them. Now, I have had people with Parkinson's where I was able to discharge. They were able to manage the program and kind of slow the progression. So at that point, the therapy would move from restoring function to helping you maintain it so that you don't have to suffer any illness or injury from not having the therapy. Yeah. Do you have to do some things for that? Do you need to justify it? Absolutely. As a clinician, you need to justify that, but you should never leave somebody high and dry because you don't know how. And here's the good news. If you check in with us at Novoleo Therapy and Fitness, we run courses. We just did some over the summer. We're going to probably do it again in the fall, where we run classes that show you how to do a maintenance program, when to do a maintenance program if it's needed. So there's lots of resources out there, and quite frankly, there's no excuses. If you're a provider, you need to know this stuff. And if you're a recipient, I implore you to go on to Medicare's website, figure out what your benefits are. You have robust benefits. You've given so much of your life to us and to the workforce and the country. So please allow us to help you, but know your rights. And that was it. So I'm just kudos to the therapists at Novoleo Therapy and Fitness. Cheers. You did it. You did a great job. You always do. And I can't thank you enough. You can check out our website down below and see all the fantastic therapists we have. Thanks so much for listening.